Okay, everyone, can you hear me okay? All right, I think we're gonna get going. For those of you that don't know me, I'm Tracy Hutchins with the Upper Valley Business Alliance. And what I'm going to do is introduce everyone here who's at the table with me. And we are going to first hear from our Lebanon City Fire Chief and updates from our two town managers. And then I have some information to share from New Hampshire Employment Security and the Small Business Administration. And then we will open it up to questions from those of you in the audience. I want to thank you who are here with us for coming today. I also want to thank everyone who is online with us. And I want to give a shout out to CATV for filming this for us, and we will share this on our website and via email later for those of you that were not able to attend this morning. So with me I have Hanover Town Manager Julia Griffin. I have the Lebanon City Manager Sean Mulholland, the Lebanon Fire Chief Chris Christopoulos, and
Deputy City Manager, Public Information Officer for the City of Lebanon, Paula Mayville.
Thank you, Paula. So, Chief, why don't you take it away?
Good morning. As you can imagine, as the COVID-19 outbreak, I'll say, transforms day to day, it's been a whirlwind few weeks. We had our first case in the Upper Valley on March 1st, and by way of background, the city has been a key player in a 12 community public health emergency response planning region for over 14 or 15 years. We have assisted in
unknown participant is now joining.
We participated in the H1N1 a number of years ago, and we've had a little bit of practice at trying to help manage information. Our public health emergency plan for this 12 community region, largely in New Hampshire, we have some participation across the river in Vermont, which works pretty well. Has what's called a multi-agency coordination entity, or MACE. Our MACE has been operational since March 5th. And
West Lebanon Supply
is now joining.
We are typically right now open at least 8 to 5 daily at some level of activation, whether it's partial or full. We were full, we're back to partial right now. And largely what we're doing is monitoring information, helping to provide timely information to our community partners, and that audience is a very, very broad audience in the context. And to coordinate resources. We are currently, doing our due diligence relative to the needs for protective equipment for our public sector healthcare providers, so police, fire, EMS, school nurses. Largely, I think that would be the gist of our audience that we're kind of responsible for in helping them to get the things they need. To date, we have 3 confirmed cases in our region. All 3 of those cases at current are tied to one individual. So it doesn't appear at this point that we've got cases that are just popping up with no relation to the first individual that was test positive. Do we expect to see that change? In looking around the country, it's likely that we're going to see more cases. I certainly don't have a crystal ball and can't predict what is going to happen. But we are really actively engaged with our state and regional partners and all of our local government officials. We've had some very robust conference calls, and we are doing our due diligence to ensure that we provide the best information we can for the public. With that said, there are 3 resources. There's a checklist that I put a few out on the chair this morning to assist business administrators. We'll make sure that that's up on the City of Lebanon website. If you go to LebanonNH.gov, We have a COVID-19 page that we are updating daily as we receive new information, but there are a lot of resources there that are available, and a lot of the communities in our planning region are kind of pointing people there rather than reinventing the wheel. So I know there's a lot of information out there depending on where you want to find it. We're trying to find relevant, timely information and make it available to the public. So I think it's a phenomenal resource. I've heard a lot of good comments about it. In addition to that, New Hampshire 211 is operational as of yesterday. Matter of fact, they took 96 calls in a 5-hour.
Is now joining.
In a 96 calls over a 5-hour period of public inquiry. So we know that there's a lot of need or desire for information. The last thing I'll say related to the response is we're deeply embedded with Dartmouth Hitchcock and Alex Peck-Day in the City of Lebanon's emergency management structure and their incident command. One of the messages that I was asked to bring forth to the business leaders today is they are being inundated with requests
David Watt
is now exiting
from employees looking to receive notes to go back to work because they may have been out with a common cold, or we're getting into allergy season, we're still in the middle of flu season, and they'd like to, it's really overwhelming some of their clinicians. As you can imagine, they're dealing with a lot of things related to this at this time. And if we could discourage business owners from either requiring notes to come back to work under that context or suggesting that people contact their primary care physician, it would be a better mechanism than trying to get to the clinicians at the hospital. The clinicians at the hospital are not going to give a note without a visit with a patient. So if somebody calls in and says, hey, I've had a cough and a cold for a few days and my employer wants me to come back to work, but I need a note, they're not going to just write them a note. And there are just not enough appointments to manage that and manage the day-to-day stuff that's going on. And as an example, they had over 40 some odd people show up to the emergency room yesterday begging for testing on COVID-19. Just cold calls showed up. That's very overwhelming to the facility. So please just kind of use some caution in how and what you're asking your employees to do. If employees are sick, the best thing to do is let them stay home. And I think you'll hear a little bit more about some of the resources that may or may not be available. Standard precautions for prevention: keep your workplaces clean. Sanitary wipes, household cleaners, hand washing. I know hand sanitizer is pretty much non-existent at this point. Soap and water and washing your hands properly and often is one of the best preventive measures. That's all I have.
Okay. Thank you, Chief. Would our town managers like to add anything?
Just a couple of things. We've been on the phone. The governor called me yesterday. I also spoke with the commissioner of DHHS, Lori Shibanet, and the director of Homeland Security and Emergency Management. We're working to further coordinate our efforts to make sure that we're working closely with the state. It's been obviously for them, they've been on this for the last 2 months, working very diligently at this. And we've been streamlining that and making that better. Been a few bumps in the road as it's going to be with any type of incident, but we've made a lot of progress in ensuring that coordination is effective and that we're sending the same messaging out to people.
And from Hanover's perspective, I think the announcement by Dartmouth College that spring break will happen for undergraduates online through the end of April was sobering, because so many of our downtown businesses depend on foot traffic that's generated from the campus. The good news is faculty, staff, and graduate students are not included in that online work, although I do suspect that a fair number of faculty and staff may be working remotely. So we're not seeing a complete disappearance of our campus-related population from this weekend when they head out for spring break through the end of April, but we will, I think, see a significant decrease in foot traffic. That concerns, obviously, our restaurants and retailers. And so we're eager to hear from downtown Hanover businesses about any suggestions you have for ways the town can be of assistance to you. I know our health officer and deputy health officer said, boy, this is that opportunity for restaurants to do that really deep cleaning because it may be
Gina Newbern
it may be a little quieter.
Is
in
now
your restaurants.
exiting.
So there may be some creative ways to make use of your staff's time in a downtime, but I also recognize that there's financial hardship in the future for those who are going to see their business traffic down. So far in Hanover, we're not canceling public events yet. By public events, I mean town-sponsored events, although we're in discussions about when will be the time to do that. We are under significant pressure from school parents to think about closing the schools, as is happening all over New Hampshire and all over the country. Again, because New Hampshire's not seen community spread of COVID-19 yet, the recommendation from the state is that's not necessary, but truly it is a day-by-day, hour-by-hour process. We're all sort of glued to our smartphones and our laptops and our website sources for up-to-the-minute information. But for now, it's business as usual. We would say, as
Unknown participant is now joining.
as we had done within our own public facilities, we're trying to demonstrate, lead by example, demonstrate good behavior. So we are wiping down to beat the band. After every meeting in our meeting rooms, folks are wiping down tables and chairs with alcohol wipes. We've manufactured our own Purell and tested it on some of our own hands to make sure our formula is good to replenish our municipal source of Purell. And we're also wanting to be upbeat for everybody because this is an uncertain time and scary for some, and you just don't want folks to be coming into town hall looking at a bunch of employees who with dour looks on their faces. So just know that we're not closing town hall, we're not closing public facilities, we're not canceling public events yet. We're working very closely
Schindlinger
with the school superintendent in
Now joining.
ongoing discussions about the status of our public schools, and we're coordinating extremely closely with Dartmouth College as they've worked through all of these layers of decisions. But we're also there for downtown business leaders and business leaders in the region. We just need to hear from you, preferably by email if at all possible, rather than a phone call. It's much more efficient, and we're just galloping to keep up with all of the single telephone calls we get from folks very often asking for the very same information we've already disseminated to 18 people in the previous hour. So email communication is really helpful. julia.griffin@hanovernh.org. Get it to me and I get it to the appropriate staff person for a response.
Great, thank you very much, Julia. I wanted to go over a couple of things that we anticipated you may have some questions about. One is about eliminating payroll taxes for employers and employees. You may have heard speak of this on the news. The president has talked about something along those lines. Yesterday I spoke with Richard Lavers. He's the Deputy Commissioner of New Hampshire Employment Security, and he wanted to let you all know that this proposal is still at the federal level. It has not gone through Congress yet, so it has not been enacted. Also, yesterday, Governor Sununu has sent some proposals to our state legislature. He is proposing to eliminate the week-long waiting period for unemployment benefits. He would like to allow individuals affected by their employer closing or reducing hours to be able to receive unemployment benefits. He is looking to allow self-employed individuals who are unable to work due to the COVID-19 to file for unemployment. That would be a change, of course. Right now, self-employed individuals are not eligible. And he is also looking to allow unemployment benefits paid to individuals to be charged to the Unemployment Trust Fund. And
Two participants are now joining.
And so it would not have an impact on the tax rate of businesses. However, again, these proposals still have to go to the legislature.
Is now exiting.
So at this time, those programs are not enacted but UVBA will be watching them, and when we find out that something has happened, we will let you know about that. However, the commissioner
Is now joining.
did want to let the businesses know that there are existing programs that may help businesses due to the loss of business or who have to reduce their staffing. And if you have questions about that, you can call the Deputy Commissioner at 228-4064, or you can email him at richard.j.lavers, Lavers, at nhes.nh.gov. I will send this out to our businesses as well, and we will put something later on our website. I also had a conversation with our New Hampshire Small Business Administration, and the SBA is offering economic injury disaster loans to overcome temporary loss of revenue. Those are in place right now. We will include information on that on our website as well, but you can contact the Office of Emergency Management at 223-6169 if you have questions about that. So if you as a business are starting to experience loss of revenue, or if you think you may need a loan to get you over this period of time, you can contact the SBA. Those programs are there and in place now. We will also be monitoring any upcoming legislation. There's been some other talk about, using Medicaid, Medicare benefits, and nothing has gelled with that yet. But again, we will be watching it, and as soon as we have that information,
Unknown participant is now joining. Unknown participant is now exiting.
We want to thank everyone that's joined us online. I know that this is a little disturbing as we're talking, but it's great that we have this capability.
Is now joining.
As Julia was mentioned, I would also urge you to start thinking about some creative ways to continue conducting business. I know that this is an opportunity for you to try to reassure your customers. If you have social media, that's a way for you to engage with them. I will be looking at different tips and try to send that out to you, but you may want to consider doing some things like if you can have your customers call in to purchase something and then have it available for them and deliver it to the door. There's not going to be a one-size-fits-all because all of your businesses are unique and have different circumstances, but if you have any thoughts, please share them with me and then I can share them out. I'm also in contact with other chambers across the country who are also experiencing this. There's other areas that have been hit very hard by the COVID-19 virus, and we are all in the same boat. I would also like to ask any of our businesses who have been in business for a long time and who have weathered other scenarios like this. There was the bird flu many years ago. There's been, seasons with a very bad flu season. And for some of you who have been in business a long time, you have come through that. And if you can share your experience, it could help some of our newer business owners. I don't think it can be overstated that now is a time for us to all help each other, because this will end at some point, and at the end of it, we still want to have a thriving local economy. So the more we can do to help each other, the better. And if UVBA can be there to try to disseminate information and pass along tips and be that conduit, that's what we would like to be. My email is Tracy, Tracy, at uppervalleybusinessalliance.com. We will put information on our website as well. So I think now we'd like to open it up for your questions. The call-in number is 1-929-229-5356. The conference ID is 476-146-754 pound.
Want to repeat that?
Certainly. Phone number 1-929-229.
David Wyden.
5356,
Is now exiting.
and then punch in the conference ID 476-146-754 pound symbol. Okay, does anyone have questions for us?
So what is the difference between COVID-19 and H1N1 bird flu? You know, those other pandemics or influenza, they went over my head. It wasn't anything like this. So what is the difference?
Maybe our chief can take that?
So one of the main differences is this is not a flu. So it's not a seasonal flu. It's a virus that evolves that we don't know, or the experts don't know a ton about. We don't have any vaccine, so it's not like seasonal flu where typically we can be vaccinated, or even with H1N1 where they were able to create a vaccine in a relatively short period to help manage that pandemic. This is much different, and there's still some uncertainties on how it spreads in terms of whether you have to be symptomatic or non-symptomatic. There are differences. And everything that I've been hearing or reading suggests that we probably won't have a vaccine for up to a year, year and a half. So it spreads pretty quickly. It has a much higher mortality rate in comparison to seasonal flu, although we're well into flu season and we have lost, unfortunately, a lot of people to flu. By comparison, this is a significantly higher mortality rate because
Is now joining.
of the virus. The other main difference is that seasonal flus are really non-discriminate in terms of the age bracket with severe illnesses or injuries. Typically, it's children and older folks. This is really the serious health concerns or health issues are arising largely in the population over 60, and typically people over 60 with some underlying health conditions. So there's some significant differences between the two, and I think from everything that I'm reading, hearing, that's largely some of the concerns. On the upside, you know, some of the things that this progressed very, very rapidly in China, and China is seeing a significant decrease in the number of cases. Is it partly to some of the social distancing steps and the actions that they took? I don't know that. I would suspect that everything that I've learned about social distancing suggests that you can significantly reduce the rate of spread by implementing social distancing practices.
Any other questions? Do we have any call-in questions?
Yes.
Good one in the back.
I'm curious about what threshold the city would have for requesting social distancing at a greater level. There's a lot of pressure in the community from people, from our constituents, to start going in that direction. And we've been saying we're looking to the city and to the public health advisories before we take further action. So I'm curious, you know, where the city is, if there's a threshold that you can speak to. I know it's all day by day, but...
So from my perspective, we're taking our lead from the State Department of Public Health. They are the experts. I'm not a microbiologist. I didn't stay at a Holiday Inn Express last night, or a Marriott or a Hilton. I don't want to offend any of our local business owners. The reality is that, you know, we're trying to stay the course. We, as Julia indicated, we're not seeing widespread community-to-community outbreak of this at this point. We have 3 very isolated cases right now in our region. And I think and I think Sean alluded to this and Julie alluded to this, that if we start seeing more growth or more spread as they are in other parts of the country, I think you would start to see a lot of some of that, those
Deb
measures.
Schindlinger.
We are meeting,
Is now exiting.
daily meetings with our school superintendent here in Lebanon. I know that the school superintendents in a number of our communities are actually having a conference call today. So we're staying engaged. We're staying engaged with who we feel between CDC and the State Department of Health are the experts. And we're not afraid to make those decisions, but we are at a point where, I guess this is my catchphrase, I kind of laugh about it, but I'm trying to help people make decisions based on information and science and not emotion. And I
Is now exiting.
It's a balance. I live and breathe in this community. I've been here for over 18 years, and I understand the pulse of the community. But we want to make the best decisions we can without impacting businesses, impacting city services, impacting quality of life.
So the reality of it is, the way this will roll out, when the time comes, we will ask people to, because we don't have the authority to actually cancel private events, only the public events that we actually run as a city. So the way it would most likely occur is that we would ask people to cancel events, private events, certainly performances, those sorts of things, when the time comes to do that. And as the chief indicated, the empirical evidence simply is not there to do that. Yes, in other parts of the country, they need to do that, but we are not there yet. That time is most likely will come at some point. The only person who has the authority to actually dictate the closure, the cancellation of events or closures of buildings is the governor himself under state statute. So we'll take that guidance when it comes down. But we don't want to issue out guidance that's really not appropriate at this particular time. The idea is to minimize that period by which businesses are going to be negatively impacted, because that will have a long-term effect, and we're going to have some impacts here. There's been lots of discussion about a short-term recession coming up, and a lot of our businesses operate in the margins. So that if we overreact right now, that's going to destroy those businesses. They're certainly going to have a difficult time when the time does come, and it is likely to come at some point. It could be hours, it could be days, weeks, or months before that happens here, but it is likely to come. And we're being prepared for that, to do that at the right time.
I think the other thing I would say, however, is it's not too early for everybody to start practicing social distancing and the cleanliness approaches. And for example, I was speaking at a leadership Upper Valley gathering on Tuesday, and the staff from Vital Communities were very careful to make sure that all the participants were sitting about 6 feet apart, brought hand sanitizer, encouraged people not to sit at tables together for lunch afterwards, but to sort of disperse. Just everybody needs to be conscious of this. And even in your own businesses, if you've got employees who are all clustered together in work cubbies, think about how you can distance their proximity to each other. Think about how you interact with your customers. Think about gloving, think about hand sanitization, think about washing down surfaces all the time. I just think we can't do enough of that, and that's what we're hearing first and foremost from our public health officials is wash your hands, clean those surfaces, practice social distancing. I've had pastors at churches seek advice as to whether or not it's time to cancel church services. It may well be that there's an approach to conducting those without having everybody crammed together right next to each other in church pews. Got an email from our one question survey from Hanover Rotary Club. We all come together for lunch once a week on Wednesdays. They noticed that attendance was really low at our meeting this week. Is it time we just put our meetings on hold for a couple weeks and take a deep breath? And I think they're probably going to hear from members, yeah, that probably makes sense. So it's a lot of it is just using some common sense and trusting your gut. And particularly if you're in a leadership position where other people are looking to you for advice or suggestions, this is an opportunity to lead by doing.
So when you talk about canceling like lunches and stuff, one of the things that concerns me, so we're in a mild panic stress level, right. And suddenly I'm not having much face-to-face social interaction, and that's going to raise my level right. of things. So I think that's what weighs on me about canceling. I agree with the social distancing, you know, trying to make accommodations on that, but I am so loath to cancel, like, we're not going, you can't come here anymore.
Yeah.
You got to stay at home by yourself.
I know, Suzanne, and I had this very same conversation with my 88-year-old mother who's suffering from early congestive heart failure in Michigan with the first case in Hanover, and was telling her she was grounded, essentially, which is very refreshing for a daughter to be able to say that to her mom. But we talked about that social loneliness that comes with sort of self-monitoring in a quiet setting. So it's the downside of concern, and we all have to figure out how to balance that. But I think being aware, particularly with the people we're gathering with, about how we help each other to stay as healthy as possible through social distancing. And I'm not shaking hands with anybody right now. I'm doing elbow bumps or the Chinese foot taps, and that we've seen online that look so effective. And we're all trying to sort of mirror good behavior, but not go overboard.
But not stop social contact. Because, of course, the lunches happen at Skinny Pancake, so we don't want them, you know, so, yeah.
Right. So it's a balancing act. I just think we in business leadership positions, retail and restaurant ownership positions, really talking with your staff about how you maximize the opportunities to demonstrate good personal hygiene in the face of this is a really important leadership opportunity we all have.
So, Tom, if you could unmute the folks online.
Been trying to.
Okay, we just got this up and running yesterday, so
The people coming in are unmuted. The people that have been in the meeting are muted.
Okay.
For some reason.
Okay.
You can't unmute them?
I can't seem to unmute it.
All right.
They might be able to do it on their end.
Okay.
I'm not sure.
Any other questions we have in the room for folks here? Anything that you're curious about, want to know about?
Can I
Go ahead,
take
Paul.
a minute?
I'm a call-in person. Can you hear me?
Yes.
I have a comment, which is that if other businesses are having to lay off staff, I would recommend I urge them to consider contacting a local cleaning company, because cleaning companies are being inundated with additional service requests and, in fact, have opportunities to hire some extra people. Kind of weird, but with personal protective gear, at least at a current level, you're at no more risk than you are for normal bloodborne pathogens such as hepatitis B and normal quote-unquote germs at present.
Unknown participant is now exiting.
Just a thought.
Thank you.
Thank you.
Thank you.
And maybe we need to think about creating a local employment clearinghouse for just that reason. If a business is having to make some decisions to cut staff, if there were one location they could report that reduction to, whoever the receiver of that information is,
Right.
like the UVBA might then be able to connect those staff members with another company is saying, funny you should say that. We're in a point right now where we can't find enough people because suddenly our service is in demand.
Right. You certainly could email us and let us know that, and we could try to make those connections for you.
Paula, you had something to add?
So, yeah, I just wanted to kind of come back around and touch base about what Lebanon is doing specifically. So we have our website, which Chief mentioned a little bit earlier, which is lebanonnh.gov. We have a COVID-19 page specific dealing with everything on a local level that we can. We have all the resources up there that point to what the CDC is offering and what the DHHS is offering. On March 4th, we stood up our regional MACE, which is our multi-agency coordinating entity. We've since merged our MACE with one that is formed in Sullivan County. So we have an outreach through our website, which is now kind of like a regional repository with 20 some odd communities. So as the public information officer, I'm constantly taking in information and I'm constantly pushing out information to all of those communities. On there and on our website in general is our subscription to our alert service. So if you haven't subscribed, I strongly urge you to go on and subscribe, because you'll get updates as soon as it's posted to our website, and we're using our website as the repository to push information. So anybody can subscribe at any time, and you can unsubscribe at any time, but for the time being, I would strongly urge it. Many of you may own businesses in Lebanon, but are not residents of Lebanon. So your communities may be part of who's receiving all the information that we're receiving. And now that the state has stood up a joint information center and have opened 211, we're going to be in even more collaboration with what's happening there. So if you see, you know that there's information out there that may not have made its way to us that you think would be helpful that we disseminate, get us that information. We'll be more than happy to host that. LebanonNH.gov/COVID-19.
Great.
There's nothing else?
Any more questions? Any online for us? Callers?
So it sounds like callers may be able to unmute themselves if we can't unmute them. So anybody's calling, if anybody's out there and wants to ask a question, you may be able to unmute from your end.
Okay.
Multiple people are now exiting.
I guess we're done.
Wrong button.
Unknown participant is now exiting.
So before we all...
Multiple people are now exiting.
Exiting.
All right, everyone, thank you so much. More information will be coming out.
Hello, can you hear me?
Wait, hold on, folks. Question? Yeah.
There are several questions in the text.
Is now
function.
exiting.
So if you can check the chat function, there are several people with questions that are putting them in chat.
Oh, okay. Thank you. Aha. We'll get better with this through practice.
I can't read them, Tom, so I can't see that far. I need a telescope.
If you just read them to us there,
Sure.
Tom.
Audios. Okay. Can we confirm, reiterate, fever is the leading indicator of infection?
Correct. A fever of greater than 100.4 degrees Fahrenheit.
Has there been any variation in symptoms in local cases versus what has been reported broadly?
Not that we're aware of or has been reported to us from the state.
We've started a few things such as offering curbside pickup by
We're trying to digest this question here. Hold on, folks.
Do you want me to take that over, Tom?
So the other thing I will say to the online audience here, if you can email me at fire@LebanonNH.gov, fire@LebanonNH.gov, and I will do the best I can to answer your questions or find an answer for you.
I have one question. I was curious, do we know how often we will be getting updates from the states about potential school closures?
Hourly, if not more often. We are receiving a lot of information, at least daily, from the state related to the number of cases. Understand there are a number of cases that are being still tested, or people that are being tested. There are a number of people still being monitored, upwards of 270, I think, as of this morning. I suspect that, as this evolves, we will get timely information from the state, and we will do our best to push that out through our resources.
Just to add something there, the schools are part of our regional MACE. They're cooperating with us. They've been meeting with us, and they do have a direct line to the Department of Education, and they have conference calls. I had one yesterday. I think it was at 1 o'clock yesterday, and we're getting direct feedback from our superintendent on that. So we do have that line of communication that is going, and right now the guidance has not changed, that schools should remain open.
And in Hanover, our health officer, Deputy Chief Hensley, is in constant contact with the school superintendent and principals. Very robust, ongoing discussion going on there with lots of input, obviously, from parents and teachers as well. But so communications at the local, regional level are active.
So, yeah, so there's one here that, Tracy, I think probably you started talking about this a little bit earlier, but
Okay.
it says, it's from WLFS. I apologize because I don't.
West Leb Feed and Supply.
All right, so from West Leb Feed and Supply, thank you. We started a few things such as offering curbside pickup, buy online, over the phone, pick up at the store, getting the word out that we offer delivery options. Local First Alliance is also launching a promotional campaign to remind the community that small local businesses need support and patronage right now. But what are some other recommendations, ideas, or tips for businesses besides best cleaning practices to offer help, but to ensure that we can continue operating as usual?
Right, and again, you know, I think technology can help us here. We all have the capabilities in our smartphones, really. So West Leb Feed and Supply, they're right, you know, doing exactly what they should be doing. They are engaging with their customers. They're looking at ways to do the curbside. I know that may not be appropriate for all businesses, but think how you can do something creative. If you're a business that meets with clients, think about maybe doing Skype or Zoom. If you're a business that sells, you can still let your customers know through social media that you are open. You could decide to do, say, a Facebook Live post at the same time every day and tell them what's going on in the store. And, you know, and show a little levity as well, because I think at some point we're all going to need that as this continues, you know. Show your customers what you're doing.
Unknown participant is now exiting.
To make them and their experience more comfortable. You know, take pictures of your staff wearing gloves and waving. You know, I've seen memes online, you know, a free gift of a roll of toilet paper with purchase while supplies last. I mean, you know, it sounds silly, but we're going to need some silliness at that point. So again, I will be looking for things like that. I will be compiling that information. I will put it in our newsletter. I will put
Unknown
it on
participant
our website.
is now exiting.
And you know, and thank you, West Lebanon Feed and Supply, for sharing that with us. Like again, one size isn't all, you know, it doesn't fit all. What works for one business may not work for every business. But I really encourage you to look outside the box as to how you're doing business and how you can be creative.
I was on Facebook last night and I'm Facebook friends with a local esthetician who put on a great video she did yesterday about how she sanitizes in her practice and all of her tools. Fascinating. I didn't know that there were those various levels of EPA sanitization required, but brilliant move on her part just to sort of put people at ease. And I sent her a Facebook message and said, bravo, that's absolutely the way to approach this. So it is
now exiting.
Get creative. There are lots of things you can do to reach out to your customers in ways that you know, just may not have had to do in the past.
Scott. Is now exiting.
Creative is important.
UVBA will be sending out some messaging as well, very likely later today, to the public, talking about things that the public can do to still support local businesses. For instance, if they don't want to come in to shop, they can buy a gift card and use it at a later time. So
John Dameron.
We will get that information
is now
out
exiting.
As well.
Okay, any other questions? Did Spring, any other questions in here? We have nothing else, I take it on there?
Nope, nothing
Okay.
else.
Thank you.
Thank you all.
Thanks, everyone.
Multiple people are now exiting.